Hello, my name is Sermin Aras. I'm a dietetic intern at the University of Southern Mississippi. Today I will perform a nutrition focused physical examination on a mock patient. Since this is a mock patient, he is pretty healthy. But for the purposes of this video, I will explain thoroughly as I go through the physical examination. In real life, I will not be talking to the patient this much and I will not be explaining what I will do. Personally, I think that it's a really good idea to incorporate some assessment questions regarding the patient's intake throughout the examination. Now let's move on to the video. Can I come in?
Yes.
Hello,
Hi.
Mr. Etamkaya.
Yes.
Hello, I'm Sermin Aras. I'm the dietetic intern in the hospital. How are you doing today?
I'm doing good. How are you?
Thank you. The physician consulted me for a physical examination on you. It's just going to be a head to toe examination and it's not going to hurt or it's not going to take very long. Are you comfortable with that?
Yes.
Okay, I'll just go and wash my hands and put on some gloves, okay? So I'm gonna start with your hair. So it's clean and thick. There's no sparse hair or depigmentation. So no nutrient deficiency is suspected here. I will look at the temporal region. There's no spooning or protrusion here as well. So no protein or energy malnutrition. I'm looking around the eye area. I can see some yellowish nodules around the eyes, which is a sign of hyperlipidemia. The eyelids are not inflamed. I'm looking at, I'll just press a little bit here. So I'm looking at the conjunctiva. It's not pale, so no iron deficiency suspected. I'm looking around the cornea and I can see some fine blood vessels around, which is a sign of poor nutrition. Then I'm looking above the cheek area and I can see the fat here, so there's no loose skin or dryness. How is your overall fluid intake throughout the day? Do you drink a lot of water?
Yes.
Okay. So next, I'm moving to the mouth. I'm looking at the corners of the mouth. There are no cracks or sores, so no B vitamin deficiency suspected. Can you open your mouth a little bit for me? Okay, so I'm looking at the tongue. No glossitis or no sores or atrophy of the papillae, which is good because no signs of B vitamin deficiency. I'm also looking at the gums. You can close your mouth. Do you have any bleeding on your gums or anything?
No.
So I couldn't see any gingivitis either. So next I'm going to look at your neck area for any distension of the jugular veins. So there's no distension, so no hypervolemia. Next, I'm going to look at the clavicle bone, which is not usually seen, like protruded in males, but I can just see it a little bit with the acromion process, kind of bulged here. So which can be a sign of mild to moderate malnutrition. Next, I'm looking at pectoralis major and the trapezoids muscle here, and I can feel no bony structure but the muscles here. Then next I'm going to look at the deltoid muscle, which is you can just which is round and nice, so there's no muscle wasting here. And can you just hold your arm for me? Okay. Next, I'm looking at this area. I'm just pinching a little and I can see like fat between, like ample amount of fat between my fingers. which is good. Thank you. Turning around a little bit for me, please. Thank you. So next, can you just push my hand? I would ask the patient to push a solid object here. Now I'm looking at the thoracic and lumbar regions of the ribs, and there is no depression between the ribs, or I can't see the trapezoids or the bones here protruding, as well as the mid, I'm looking at the mid axillary line, and the iliac crest is not seeing protruding here. Okay, thank you. Can you make an okay sign for me, please? So I'm looking here, there's no depression, and there's ample fat here, which is a sign of no malnutrition. And then next I'm going to look at the skin and the, have you ever experienced dry skin lately?
No.
Like a light pinch here, so it goes down very well. No sign of dehydration. It's really interesting that our nails tell a lot about our nutrients. They are made of proteins, but especially sulfur containing ones, as well as a lot of minerals. So I'm looking at the lunula on your nail plate, which is very obvious, seen here with wide lunar shaped, which is good that you don't have protein deficiency. I also see no colonicea here, which is good that you don't have iron deficiency. And I'm just pushing your nail plate. It turns wide, and when I move it back, it just turns out a very good vascularization here. So I will ask you to move a little bit forward, please. Thank you. And so I'm looking at the patellar region here for any sign of bony structure, and looking at the anterior thighs, which is like nice and round with muscles. And lastly, I'm going to look at the ankles and feet for any sign of pitting edema. When I put my finger, it just comes back naturally with no signs of pitting edema here. So we're finished now. You can just, I just saw that you just have, you might have noticed these also little nodules here, which might be a sign of hyperlipidemia. It's not like serious. And I saw like some, were your bones like always protruded like this?
Yes.
Before? You've always been that way?
Yes.
Okay. So, and you've never experienced major weight loss recently?
No.
Okay. So, I'm finished now with the physical examination. Do you have any questions for me?
No, thank you.
Okay, thank you. I will see you later.
See you.
Have a nice day.
You too.
After I'm finished with my physical examination, I will go and chart the information that I got from the physical examination. So for this patient, I just saw some yellowish nodules around his eye area, which is a sign of hyperlipidemia. I will go and look if this patient already has a lipid profile that matches with the physical examination. In addition to that, I saw some protruded bones in his clavicle bone and acromion process, which is not usually visible in males. However, when I asked the patient if he had always been this way in his life, and he said yes. So it might be just his body structure that he has bones that are larger or protruding. That's why I tried to ask him if he had lost weight in the recent months. I will also check for any signs of assessment regarding his intake or weight status to see if he is prone to malnutrition or muscle wasting. Other than that, I could not see any other abnormalities defining any nutrient deficiencies or muscle wasting for this patient. Thank you for watching the video.